Good evening. I want to make this video because I found a site that has a lot of different, very good information in it. It has a lot of definitions, and so I know a lot of people really don't like to read, so I figured I'd read it for you. Uh, it explains definitions that are commonly used for transgender people, like gender identity. Gender identity is a personal, internal sense of being a man or a woman. Gender expression. The way a person reveals his or her gender identity is gender expression. A person's clothing, mannerisms, voice, etc. can all be a part of a person's gender expression. Transgender itself. Transgender is a frequently used word used to describe the broad range of identities and experiences that fall outside of the traditional understanding of gender. Therefore, in addition to those people who wish to transition from one gender to another, or have done so, who have often described by clinical terms transsexuals, personally what I claim myself, transgender often is meant to encompass a larger community that includes, for example, cross-dressers, intersex individuals. Some transgender people prefer to describe themselves as genderqueer, gender variant, or gender non-conforming. Not everyone who does not conform to gender stereotypes, however, identifies as transgender. In particular, there are many people, including children, who do not conform to gender stereotypes, but do not experience conflict between their gender identity and their gender assigned to them at birth. A transsexual. A transsexual is a clinical term used to describe people who experience a conflict between their physical sex and their gender identity. For example, a person who is born with female body but with primarily male gender identity is considered a transsexual male or a trans man. And same goes for a male to female. They go as a trans woman or a transgender woman or transsexual woman. Because the term has clinical roots, it is widely used to describe the subset of people who wish to alter, are altering, or have changed their bodies hormonally and or surgically to match their gender identity. We have used transsexual in this way while recognizing that there is no one course of medical treatment that is necessary for a transsexual individual. Gender transition. Transition or gender transition describes the long, complex process of altering a person's birth-assigned sex to match his or her gender identity. Gender transition can include hormone therapy, presenting full-time and gender corresponding to one's gender identity, and in some but not all cases, surgical interventions or procedures. Gender identity disorder is the medical diagnosis for individuals who experience a disconnect between their birth-assigned sex and their gender identity. The term gender dysphoria is often used instead of gender identity disorder, reflecting in part of skepticism about whether it is appropriate to consider dissonance between one's gender identity and one's body as a disorder. And sexual reassignment surgery, or SRS, as most people would call it. This phrase is commonly used to describe certain forms of transition-related surgical procedures, and usually refer to genital reconstruction surgery. Notwithstanding its regular use, this terminology is faulty on numerous levels. First, it fails to reflect the fact that for transgender people, transition-related surgery is simply a necessary step to affirm rather than to reassign one's sex or gender. As a result, the preferred term for such procedure is gender confirmation and or gender affirmation. Gender affirmation surgery. Sorry, I lost my spot. Second, many people and courts assume that SRS, or sexual reassignment surgery, means only genital surgery, whereas that there are in fact number of surgical procedures that can be part of an individual's gender transition, including genital reconstruction surgery, breast augmentation, or reduction, and hysterectomy. Now, one thing that they did not have on here that for the definitions is HRT, or otherwise known as hormone replacement therapy. That they said a little bit about hormones, but they really didn't go into it. The hormones are pretty much required if you're serious about transition and you don't want to have any, you want to pass as your preferred gender instead of the gender you were assigned as at birth. There's many different hormones that you can take. Some of the most common ones is spirolactin, and that's a testosterone blocker. Finasteride, that's actually to stop male pattern baldness, and it also helps breast enlargement. And then, well, the one big one's estradiol, and that's the purest form of estrogen that doctors are able to prescribe. There are also many other medications out there that can help you with your hormone replacement therapy. Like, for instance, for facial hair, there's creams that you can get for reduction of facial hair, and it works, I know, from personal use. And then a lot of other common things that transgender people end up doing is they end up getting laser hair removal or electrolysis. Now actually, if you are not transgender and you're watching this, just so you guys know, even though you're not transgender, if you do know someone that is transgender and you're close to them in any way, shape, or form, you actually as well are going through a transition, because you know yourself, you're comfortable with who you are, you know who you are, you identify from the body that you have. However, a transgender person doesn't. A transgender person identifies through who they feel on the inside, and all a transgender person doing is letting the person inside out, actually letting themselves be themselves. If you love and support your child or your friend or your family member, or maybe someone you just know as an acquaintance, if we're brought up to believe that we are to reach out and grab our goals and to be who we are and to stand up for what we believe in, and then turn around to be shut down because someone else doesn't believe in what our beliefs or ways, or think that it's going against God himself or herself for actually being themselves. Just to let you know, God made each and every one of us the way we are. We are just being ourselves, and we are actually being able to be confident enough to let the world see who we really are. And yeah, a lot of people can't understand that, because a lot of people like to focus on the negatives or try to bring others down just to make themselves feel better, or just because they don't understand it, they don't want it to happen. The best way you can help support or understand a transgender person is to talk to them. And when you talk to them, don't refer to them as their birth gender. Refer to them as their preferred gender that they go by. Give them their same respect that you want them to give you. I mean, it's hard, it makes it hard for transgender people to give someone respect and to acknowledge what they have to say if that person themselves can't respect the transgender person for who they are and what they believe in. I'm sure you guys have heard the saying before, we agree to disagree. Well, just because you disagree with someone for their beliefs or their ways doesn't mean that you have to disrespect them for it. We are all human, and I guarantee you there's not one person out there that has the same beliefs or the same ideas as exactly the same as another person. Everybody's beliefs differ to something minute to something huge. And yeah, a lot of us fail to really take off our blinders and see what the world really has to offer and realize that we're all creatures of the earth and of God, and that regardless of how we feel about ourselves and how we present ourselves, we are all still loved by God and by Mother Earth. I mean, I'm not trying to disrespect anyone's religion or anything like that by saying God or Earth or anything like that. But whatever your beliefs may be, whether they differ from the next person or not, or whether you support and are all for it, respect people for who they are. Like, okay, best way to put it, you have a family member that's a drug addict. You still love them for them being your family, and you want to help them. Well, it's the same way with transgender people. They're still your family, and you love them for who they are, and you want to be able to help them. While helping a drug addict, you help them get off the drugs. Helping a transgender person, helping them is accepting them for who they are, and loving them for who they are, and respecting them by expressing to them as their preferred gender instead of the gender that you naturally knew them as. Just some food for thought. Hopefully this video can help people understand transgender, and I look forward to making more videos. And if you guys have any comments, leave them. I'm more than willing to answer any comments you guys have or questions or anything. Alright, have a good night. Thank you. Bye.